Live and local in the Imperial Valley. And as become our custom on Friday mornings, we are getting an update on the COVID-19 pandemic situation in the Imperial Valley. And with us today on the telephone, Imperial County Chief Executive Officer Tony Rouhotas and Chief of Police for the City of Calexico, Gonzalo Gerardo. Good morning, gentlemen.
Good morning, Carroll.
Good morning.
Chief, you must have heard I brought cupcakes in this morning. That's why you showed up, right?
Yes, and with my 2 cups of coffee, too.
Okay. Very good. Looking at numbers.
Yep.
And I understand that, the numbers are the bailiwick of the Imperial County Health Department. But looking at the numbers for Imperial County as a whole, our percentages are getting a little bit better.
Yeah, they've been maintaining in the low teens, which is really nice. Yesterday, I think they were at 13, which has probably been our highest over the last few days. But they're definitely trending in the right direction of where we want to see them going. And a lot of that's to the testament of the county and the individuals here that are adhering to the message and getting us in that right direction. Also, I think the more important tell is if we're going through the dashboard and the roadmap to recovery really is what our hospital ours are looking like and the numbers at our hospitals. Been in contact with the hospitals and they're not seeing the same surge amounts that they were having for several weeks that we saw days on end. The ICU beds availability has definitely kept increased and decreased with availability, so that's a good thing. So we're not packing the ICUs. Also, the other good portion is we're not having the amount of transfers out of county. That was a huge issue at the beginning of this, or through the majority of it. We're up to 600 transfers. That has diminished considerably, as well as the ACU out at IVC. The census out there has dropped dramatically as well. So we're definitely showing improvement. We have just a little bit more to do. There's a lot of preparation occurring, and public health is definitely keeping busy and preparing for the next phase of where we can go from here, but also need to be cognizant that what other counties have gone through is the potential resurgence of COVID, what you're seeing in the Central Valley right now that we dealt with a few weeks ago.
And, of course, in the Central Valley, they are using the Imperial model to fight that, right?
Yeah, so I've had conversations with some staff from Central Valley County officials and had that discussion, and we've kind of shared a little bit of lessons learned and things that we did to improve and how the state offered some assistance to rectify some of those issues. And so some of that, the help has been redirected now to the Central Valley as well.
And you pointed out the numbers. When I look at the dashboard, I see fewer ICU COVID patients, and I see fewer patients on ventilators. Being on a ventilator is not a good thing. And we see those numbers dropping, and we need to see them drop even more as we progress. But one thing we have talked about is get tested. Even though you have no symptoms, no positive contacts that you're aware of, the more people that get tested and come back with negative results, the lower the percentage is, and the quicker we can reopen an economy.
Yeah, and thanks for bringing that up. Like always, testing is extremely important. We're fortunate to have 3 sites. Again, they're in Calexico, Brawley, and Imperial actually has 2 lanes at their location in Imperial. They've also, it's important to remember, they changed the dates to make Saturday available. So for anybody that works Monday through Friday that couldn't make it to get tested previously, Saturdays are now available, so I urge you to go down there. Again, we don't want these numbers to drop too much, because if we can't maintain a certain percentage of testing for a period of time, those resources could be redirected to another county that might be in a bigger need than what Imperial County is. It took a lot of discussion and work with the state to be able to obtain the amount of testing we have available now, and we want to maintain it for as long as possible. But I can tell you some of our numbers on Tuesday at the testing sites where Calexico did 123, Imperial did 119 tests, and Brawley did 117. However, the following day, those numbers were 46, 44, and 38. So we definitely want to maintain close to the maximum, which is roughly about 130 tests per location, per lane. So we definitely want to keep the flow of tests going through. And so if you haven't been tested, your family hasn't been tested, or you have friends that are looking, they need to go to the OptumServe website and register for that.
Okay, and just to encourage that, again, the quicker the economy can reopen. Chief, we haven't ignored you. We do have some questions. Calexico, okay, you're a city of 40,000. Yeah, right. You're a city of about 250,000 every day. You've had issues with a significant number of COVID positive patients. What kind of issues is that causing you, your city, and your department?
Well, since we actually dispatch for both police, fire, and EMS, our biggest issues have been the response to any type of call that we've had. Of course, we have to use our PPEs, but being that Calexico has had the highest numbers, our calls for service when it comes to both police, fire, and EMS, it has skyrocketed ever since it started. We must do, as a city, patient transfers to El Centro Regional, PMH, EMS, and then when we respond to calls, too, it's the same thing, police officers. So we, like I said, the calls have picked up significantly. We've already, before COVID, we were responding at least 15 to 20 times a day to the port of entry to do patient transfers from citizens that live in Mexico that would get sick, and we have to do those patient transfers. When COVID started, those increased because the Mexican hospitals were encouraging U.S. citizens to seek medical help over here because they could not be seen as fast as if they came across. Now, when it comes to the crime, we've seen a significant rise in crime, and at first it was not bad for the first 3 to 4 weeks, but once some of the rules came up about the intake of prisoners or people that commit crimes into our county jails, this is statewide. But for Calexico, we saw a significant increase, and so my officers are doing more out there trying to prevent. We had to double up on working an extra person or two at night to patrol the business area, because we did get hit really hard with commercial burglaries. So we had to increase all that, and then we started getting these people that were, harassing women. We did have one attempt at kidnapping, and then we had 3-4 more after that were on the borderline of attempt. It was more like a harassment on women. So we were able to identify 2 individuals, and right now we're looking for a 3rd individual in a black Jeep, a Cherokee, like a 2006 to a 2012 model. Like I said, those are the types of stuff that we've seen. Our mental health crisis calls have gone up when it comes to the police, and this is overall, not only Calexico, but the whole state. I think what's going on there is people are not seeing their therapists or their doctors. They're not getting their medications. They're not taking their medications. So we have been responding to a lot of calls. And as you know, Carroll, whenever something happens, they call 911 or call the police, and we're the first ones on scene to assess what needs to be done. So that keeps us busy as well.
Well, anymore, a police officer is, first off, a psychologist before we even enter into the profession of law enforcement. So we understand that. Is the city of Mexicali still checking people southbound?
Yes, they are, and it's something that I've talked to some of my colleagues. They're doing those checkpoints starting Fridays. They start Fridays around 2 p.m. and they end Sunday around 8 p.m. I don't really see the purpose of those right now. And this is me talking, City of Calexico Police Chief, because they went ahead and started opening up some gyms and in the restaurants and the casinos. So we do have a lot of people coming and visiting folks. Like I was talking with the CEO Tony here, when they go to funerals. They come and see mom for their birthdays or whatever, and then they see doctors. So our traffic at first was very, you could tell there was something going on. The COVID affected everybody, slowed everything down. We did lock down our city, and then people still come over, and they do a lot of shopping here in the U.S. and there's a lot of relatives going down south, and we had let go of all of our traffic controllers that were temporary hires, seasonal hires, and we had to bring them back on an emergency basis right before the end of our fiscal year because of that big old mess that happened when they first started those checkpoints. We never got notification for the first one. So we're dealing with that, and it's true what you said. We're supposed to be like 42,000 residents, but on a single day it can go up to about 125,000.
Makes it a tough job and always has been. And, on the border, it is the Imperial Valley, and it's one of the things that I truly enjoy is it is bicultural, binational. And that is going to continue, obviously. I understand in San Isidro, they are doing northbound testing now. And, I'm not sure whether it was the county of San Diego or the state of California that instituted that. But, this virus, a fence isn't going to stop it. And people, it's mom's birthday. I have to go give mom a hug. And,
Carroll,
they do that.
We were made aware, I think it was just yesterday, about the San Diego testing occurring. Cal OES has reached out to the Imperial County Public Health Department during one of their conference calls, and there was a little bit of discussion. Nothing has been set in concrete if it's going to occur or not, but the initial conversations did begin. And I think some of it might also be in preparation just in case there's a resurgence. There's always been a talk that this could resurface, sometime in before the holidays approaching. So I think they're just pre-planning and positioning in case they need to do this. But we were made aware that they did start doing some of that testing in San Diego. Okay,
Chief, how are your PPE supplies holding up?
Well, at first they were hard to come by, but it looks like now, the state and county and everybody has stepped it up where we have what we need. The only thing, like everybody else, is the lack of Clorox or Lysol wipes. Some of my guys have. We have some supplies, but I wish we had more. Hand sanitizers, we have a lot of. Our masks, we have plenty of masks, plenty of gloves. So we're doing well. At first it was hard to come by. Everybody was fighting for the stuff, just like the toilet paper stuff. Everybody's grabbing and hoarding. But we're doing good, and we've taken extra precautions in the city, the department. I have somebody coming in. They were coming in once a week, and we were doing we were fogging our whole department, our substations, our animal control facility, our vehicles, everything once a week. Now we're going every 2 weeks. And I can see the precautions that my people are taking, so that's why we kind of, decided to do it every 2 weeks. We did have a surge of people getting sick within my department, and I want to say this happened between late April to like mid-July. But thank God nobody got really sick. We were able to overcome it, and it looks like we're doing well. I hope we don't get a second round of this going around our department because it really put a strain on everybody. I mean, everybody. I mean, we all. I mean, I was out there. My lieutenant was out there, helping patrol with calls, and we did what we had to do.
I think that's the way we look at that in the Imperial Valley. Tony, how about the county? Things holding up? Talking to one county department head, pointed out that, hey, we're having to do things a whole different way. We only do things by appointment. And, we're finding new and better ways to serve the public doing it that way. What are you seeing countywide?
So, and I've actually sat in some of these Zoom calls, either through like Rotary or been invited. Recently, I was just on one of the real estate group Zoom conferences that they have, I think, once a month. And so I pose that question to the groups that I reach out to from the local business community and stuff, and say, hey, are you being held up by anything the county's had to do to change its operations? And similar stuff. I mean, some people like to come in and have that face-to-face contact, and of course we've had to regulate that to reduce, for social distancing reasons and just contact with others. But I received a lot of positive information that due to everything, they've seen the positives of it, it's telecommuting, I think, is something, if you're maybe, depending on your age bracket, is just not something you're used to, but something we had to implement. Maybe not everybody was in favor of it at first, but once it got going and you see the productivity still there, it makes it a little bit easier to continue with it. But the operations of the county, I mean, I'm sitting here looking at Chief Chalo, and he has an orange dot on him. And that's because you have to go through a screening process before you come into our buildings. We take that serious, and that's just to minimize the spread for our own employees and make sure we're taking care of our own employees as well, because our employees are just as vulnerable as every other citizen in this community. So we're trying to adhere to any safety precautions possible to protect them, however, still continue to serve. And, a lot of our services, whether they're the wraparound services through social services, behavioral health, have increased due to this, for either on the behavioral health side because emotions and anxiety, or people not being able to work and they need that additional income support or program support from social services. So we're definitely not slowing down. Traffic and work level has picked up, and I think we're doing a good job of balancing the safety of everyone and still being able to provide a level of service as possible.
I think you hit the nail right on the head there, a balance of, okay, we've got to do this, and how are we going to do it so it is safe for everybody involved? So anything we missed? Chief, did we miss anything?
Paco, let me see. Did we miss anything? No, it's just, the only thing is, I strongly encourage people to keep on practicing, wearing the mask. I know it's hot. You can't, breathe. Some people say that, but we wear them all the time.
Try and breathe with a ventilator.
Yeah, and that's what I say. It's hard for people to say they can't breathe. It's becoming a new norm. So, I tell the people is that it's one of the first things I grab when I walk out of my office. It's my mask. I hang my mask around my mic that's next, that's on my shoulder, lapel from the shoulder. I do a lot of stuff, and not only me, but the rest of the people. So it's just learning to take the mask with you, learning, make sure you wash your hands. And if people weren't washing their hands before, that's one thing we talked about. If we have to tell people to wash their hands, there's something wrong there. I know that, it spreads and you got to wash your hands more often, but just practice the social distancing. We get a lot of calls, people at Walmart get upset, and I, like I told my city council, is that this COVID, the enforcement of it, it's on the people. It's 95% on our citizens to practice social distancing, wear your mask, wash your hands, and the other 5% might be enforcement. Now, do we want to go out and be citing everybody for a $1,000 violation for everything? No, we don't. I don't think anybody here in the county, and I don't care how much money you make, if you make as much money as a CEO, myself, or you, Carroll, you make big bucks. Or Paco, my friend Paco makes a lot of money too. So I figured that, you don't want to pay $1,000. That's the whole thing and unfortunately, the people that they want me to cite are the people that either don't have a job or work as laborers on the field. And so we do a lot of educational stuff out there. I have some surgical masks that come officers. If there's a person that needs one, just hand one out to them, and we'll give you another box. And that's the whole thing. We're not going to be handing them out to everybody, but just the people that don't have one, that need one. And so we do a lot of that stuff out there, mostly of an educational side. We have to get the enforcement. We'll do the enforcement. Somebody calls about a large party, we'll go ahead and do an enforcement on that one. But we're busy doing other stuff, Carroll.
Well, exactly. And like I said, a police officer is first and foremost a psychologist before you get into law enforcement. And with the way it is anymore, and I would think that education would be much easier to do than enforcement.
And Carroll, and I appreciate that, and I think that's why it's important. I wanted to invite the chief onto the show today. I think he sees a different dynamic being on the border and still providing those services. And the guys down in Calexico, they're nonstop. I've seen that ambulance go back and forth all day long, and that's a long trip back and forth from El Centro to Calexico on a daily basis. It's a round trip, and they deserve to be recognized. And big shout out and say thank you to everybody in Calexico. And I thought it was important to come in and maybe give his opinion on everything that's going on.
Okay.
Hey, Carroll, real quick, like I said, everybody's putting in the whole countywide, and one of the biggest, and I think people forget is that police officers, we give them praise all the time, and sometimes we don't. Our firefighters, paramedics, but actually, some of the forgotten people here are your people that do public works, cleaning up the streets that I see out there in Calexico, in another city, spraying down like our bus stops every other day. As a team, you have to have a good team citywide, and I think right now the city of Calexico, and we do have a very good team. All the department heads, we all get along and we all help each other out. But one of the forgotten heroes here are our dispatchers. I had 4 dispatchers during this bad time, Carroll, that worked 2 months straight without a day off. 12-hour shifts, 2 months straight, because of the people that were out. They had to pick it up on their side. So it's like that everywhere. Our countywide and state, wide, nationwide, our dispatchers are the unsung heroes sometimes, and big shout out to them, because my dispatchers, like I said, I had 4 of them that worked for 2 months straight, 12-hour shifts. And that's, to me, man, that shows dedication, loyalty, and commitment to the citizens of Calexico and the people they serve.
Okay, Chief, and that goes for both of you. In Tony's case, Chief Executive Officer and Fire Chief, and Chief Gonzalo Gerardo from Calexico. We appreciate the visit this morning and the information that you've been able to impart.
Thanks, boss.
You have a safe and healthy weekend.
You as well.
Coming up, another great mix of oldies.